sharing your journey. Everybody keep in mind the question and answer section will be at the end, as well as after the tough Q&A, we'll be going into the networking part with webcams on, hopefully I'm talking to everybody. So to start us off, our main presenters here tonight are Keith Schilling and Janine Kamath. I'll let you guys take over, introduce yourselves, and tell us about Mayo's journey, please.
Excellent, Paul. Thank you. Yeah, so we can kind of do quick introductions. As you mentioned, you can see my bio in the attachment there. But Keith Schilling, I'm a unit manager for Mayo Clinic Health System at Mayo Clinic, and I'm based in Eau Claire, Wisconsin. So on the western side of the state here from you. And one, thank you for letting us be a part of this, and honored to be a part of this discussion. And as you know, we talk about Mayo and the journey. We're definitely at the beginning of this journey as well. There's so much we can continue to learn, and this is just it's kind of exponential as this kind of goes forward here. So I've been with Mayo for 12 years now, and my background is manufacturing engineering before I joined Mayo, and seeing how I could apply those skills in a healthcare environment. So before Mayo, I was a part of Cray Research here in the Chippewa Valley here as a supercomputing, high-performance supercomputing company, and then I also worked in the California in a semiconductor company before moving back to the Midwest, where I'm a native from Iowa originally. So welcome. I'll hand it off to Janine, and then we can start the presentation after that.
Thank you, Keith. Thank you so much, Paul and Nicole, and to all of you for having us. I really appreciate being here, and I want to echo what Keith said, and that is we want to learn from you as well. I think we're all in this together, and there's so much learning to go around. So please, share your thoughts. We'll do our best to answer questions, but it might be more of a dialogue and a discussion. So my background is I'm originally from India, moved to the United States it's a little over 28 years ago. It just seems like yesterday, though. I'm based in Rochester, have always been in Rochester since I moved from India. In my previous, just before I joined Mayo Clinic, I had two very small stints, more as a management trainee and as a student in two large pharmaceutical companies, and then moved to the U.S. And have been in the department that Keith and I have been for, I was there for close to 25 years in management engineering, business consulting, operations research, big involvement in statistics, etc. So a lot more in business and management consulting. But for the last, 10 weeks, who's counting? I have moved into Mayo Clinic's international business, and I will be going to London tomorrow. So I may not be able to stay, Paul, for the networking. I have so much to just get ready. But it is just taken me into a whole different world, literally speaking. And I'm just learning as I go. And when we talk about data and intelligence and everything else, oh my gosh, it is just so critical when we think of a big world out there. So thank you for having us. I can't but help share that I have two daughters, and my husband is a physician who works at the Mayo Clinic as well. And clearly the top dog in our family is our puppy, Louie.
Nice.
Excellent, thanks.
All right, so let's see if I can get this technology to work. Let me share my screen. Now first, we did the little trial run before, so we'll make sure this works.
All right.
And I gotta switch this back. How's that? Can you see the full screen now?
Nope, nothing yet.
Okay. Let me try this again. I thought I hit full screen. Sorry about that.
No problem.
Let me get there again. It worked the first time we did this. Okay, share screen.
Something's starting to come through.
Keith. Yeah, it's coming through, Keith.
We are
Do you want-
seeing both the slide and the future slide. So it's the,
There we
there we
go.
go. Now we
There
got
we
main slide
go.
full view.
Beautiful.
Excellent.
All right.
Thank you.
Awesome. So again, welcome. Today we're going to talk about intelligent automation in healthcare and really paving the future now. So as we talk about Mayo's journey, like I said, it's rich. Mayo has a rich history here, and technologies just continues to advance, and we're just one is trying to understand it, and then two, how to provide better health overall to the population in the world that we partner with. So today, what we're going to cover is 6 points there. We're really going to talk about just healthcare environment overall. Going to get some kind of drill down for the top level there, and then we'll talk about where Mayo is today, and then we'll go into a little deeper dive of the actual intelligent automation with some examples there, along with talent transformation. So how do we make sure our most valued asset, which is our staff resources itself, how do we make sure we keep our pencil sharpened and being able to take advantage of this technology and apply it. And then we'll kind of give you a little glimpse of into the future too, which I do have a little video to show you. So hopefully the audio comes through. And then we'll also, as we go through all this, we also want to take a step back and look at critical considerations too that we got to be mindful of as we go through this journey. So with that, as we look at the world ahead, and especially in the 2030, this slide kind of captures some really kind of neat projections here that resonates, especially as we look at healthcare in the future. And so, as you look at the slide here, you notice that we definitely continue to see population grow across the world. Actually, another 1 billion people by 2030. We also, unfortunately, see obesity to continue to rise, which is unfortunate. So that's another opportunity to continue to see how we can augment that by 2030. With the advances of technology in healthcare and in medicine, we're expected to live longer. So you can see life expectancy to continue to grow there as the average age gets older and up into the 90s. And then last but not least, is the technology, and you can see just the huge boom and the gains that's going to play, and definitely artificial intelligence is playing a key role into that. So as you look at 2030 and going forward, how does that play into the healthcare arena? And so when we look at the ecosystem, I really want you to focus on the middle of the page, which is the centeredness is the patient, and that is Mayo's primary value. The needs of the patient come first. And you could ask any employee at Mayo, and I think it's pretty much tattooed blue on our arms, says the Mayo, needs of the patient come first. And we really take that to heart, and that's what really drives our decisions, our journey, our whole, being here and providing the service. And so when you look at, different facets of the ecosystem, from, financial side of payments and your own, personal accounts, along with your social aspects of, your faith institutions, your family. And then also, with today's technology, all the patient-generated clinical data that you can do on your own with, self-services, home health, different, wearables that you can wear today. And then, and hopefully that also ties into the health and wellness, as we also want to, continue to stay fit and hopefully trying to keep that obesity down as best we can. And then, of course, we still got, the traditional provider, generated connections there with the hospital and pharmacy and stuff. And so when you look at that, just think of how does that, provide value to the different patient populations. What I mean by that is, we're all unique, we're all different. And so how does all this play into that? And you can see there's just massive amounts of data as we continue to capture all this. And the bigger question and challenge is, is not capturing the data, which unfortunately is probably the easier piece, but it's how do we apply that and make good use of it and value of that. And more importantly, as we look at this diagram, how does it correlate with each other? And I think that's where this intelligent automation really plays into a role that we're discovering more and more every day. So as we look at shaping the data-driven future here are some trends that are out there. As you can see, the explosion of healthcare data requires a new ecosystem built around the needs of the individual. As you look at digital remote care, artificial intelligence will be fed by sensors in, around, and on us. And this data will move at the speed of now that we have 5G and beyond. Also, when you look at the highly personalized care, this is, in regards to unique individuals' habits, social determinants, genomics, and preferences, outside of the traditional demographics. And then as we participate and engage in this, there's got to be trust, right? These trusted intelligence systems will continue to emerge, really to secure the confidence and participation of us as the consumer of this technology. And then finally, this has a huge impact on the culture and how does the workforce as well as the consumer embrace this technology and in our culture and being able to rely on it, on that scientific knowledge and skills. So with that, this leads into looking at different operating models. And as you can see on this screen here, it really depends on where you sit and your perspective. You may feel you're too far to the left, which is more in that control phase where we talk about, standardization, being generalists, using best practices, IP, or you can maybe go too far to the right where it's completely autonomy, having that agile mindset, having specialists, and having that freedom. So really it's that finding that sweet spot. And what I mean by that is, we need to really find the optimal balance to drive the most value. So being part of Mayo Clinic, for over 150 years, just kind of give you some background just for you to kind of talk about Mayo today. We are a physician-led organization by Dr. Gianrico Frugia, and along with our Chief Administrative Officer, Jeff Bolton. And Mayo really focuses on 3 shields, and you'll see that in our little logo with the 3 shields, and that really represents the practice, the education, and research. And so we play in those areas, and not so much, I think as we go forward here is those are not independent. They are interconnected, and that's what we're working on is truly to figure out how can those interconnections between the practice, the education, and research be more spontaneous at a faster pace and deliver to the client or to the patient. And as we talked about, just for a logistics standpoint, Mayo Clinic definitely represented in the United States here, probably most famous for Rochester, Minnesota, where Janine is located. But I also want to mention, we do have with Rochester, it's considered one of our destination medical centers, which really practices in those 3 shields. And we also have 2 other destination medical centers, one being in Phoenix, Arizona, as well as Jackson, Florida. And sorry, I'm going to go back one. I think the other piece though is, let's see if that goes back. There we go. The other piece though I want to point out is the health system. It's called the Mayo Clinic Health System. And this is the network that really is tied to the community. And you can see in the little graph in the bottom right corner there, the Mayo Clinic Health System is broken into 4 quadrants there. And really it takes care of, southeastern Minnesota, the western side of Wisconsin, and the north, side of Iowa. And the point of that is that, there's multiple hospitals and clinics. And again, it's really trying to take care of the community in those areas. And you can see there, Mayo is strong with, 63,000 plus patients overall with, a little over 4,500 physicians and scientists. And then you can see the breakdown as well across the Rochester, Arizona, and Florida campuses, as well as the health system. But outside of the United States, Janine mentioned international. So we do have a global footprint as well. As Janine mentioned, she's going to London, and we have a clinic there, as well as we recently are working in Abu Dhabi with United Arab Emirates, supporting the, I don't know if I can say this right, Janine, but it's Shakbal Medical Center. I think I apologize because we always call it SMC. It's way easier.
Oh, it's okay.
So the point there is, as you can see, is we do have quite an international play, as not only just in clinics, but we have joint ventures, we have care networks, and this is where how we can share our knowledge and expertise across the world. I think the big point here too is as we go forward here with Dr. Ferrugia coming on board, we put together a Mayo Clinic 2030. And this is really our bold forward plan. And the point here is really that to empower staff to solve, simplify, and innovate so we can advance the way we care for people. And this really is to inspire us to reach more people around the world and expand what it means to put the needs of the patient first, both today, or I should say today, tomorrow, and always in the future. But as we look at the bold forward plan, we break it down to our strategic plan. And this is where you can see how really we navigate to embrace the forces of all the change around us. So Mayo Clinic will move forward into 3 key areas: cure, connect, and transform. We also have as the foundational element, the people, innovation, and environment. And that's really the core to help support the cure, connect, and transform. When we talk about cure, our intention there is really it's the core to Mayo Clinic identity, and this is really focusing on discovering the next generation diagnosis, treatment, cure, and prevention to provide the ultimate health to the population in the world. When we look at connect, this is about how people experience Mayo Clinic, and really more importantly in a more consumer-friendly way. So it's easy. It's we break down those barriers of trying to the challenge that we face as we try to get the appropriate care and the right care, and so really it's trying to make those connections not only within Mayo but also and you'll hear more about it in more of in a platform standpoint, and that's where we jump to the transform side of the house. And in this area, we look at really disrupting healthcare using as a platform business. And like I said, Janine will go into a little more depth of some of the platform experiences and opportunities that we're currently in. And then finally, like I mentioned, our foundation piece is the people, and really it's having the Mayo Clinic staff being empowered and having the tools to succeed to execute to the 2030 plan. So when we talk about artificial intelligence, or sorry, intelligent automation, I just want to kind of give you an umbrella of all the technologies that entails. And from our perspective, it really falls into these 6 areas, and it's the robotic process automation. Again, this is where we can use software to mimic repetitive administrative things that humans do on an interactive basis, and how do we leverage applications to execute those processes in a more efficient way. And then we look at document intelligence, and again, this is using artificial intelligence to really look at extracting that relevant data on that on that document in a structured format versus and providing that in more of a using machine learning techniques and having that available versus trying to read and pick out those pieces when needed. This way we have the system do that and highlight those key areas of focus and value. Then we look at virtual agents. This is the more of the conversation computer generated character that simulates that conversation. So probably more like a customer service representative, kind of like these chat bots that you see when you go to websites. Mail's definitely using kiosks to help provide that functionality as we want to streamline that for patients' ease of and efficiency of being able to either schedule an appointment or register or as well as check in for their appointments. We move over to natural language processing. Again, that's another component of artificial intelligence. And this is really where, using computers to really help understand, interpret, and manipulate human language, which then, a nice tie to that is machine learning as well, which is more on the science side and using statistical methods to enable computers. And this is where really we learn from experimentation. And then finally, we have the computer vision, where we allow computers to really see, identify, and process images. And that's so readily important, especially as we look at radiology and all the MRI and CT scans that Mayo has in our data warehouse. And and you'll see some of that in some of our examples, but it's not saying we're trying to replace people, but how do we be more leveraging that technology to look at it from another perspective to gain that additional knowledge and interpretation to help diagnose and treat in a more concise and faster manner. Artificial intelligence. Oh, was there a question? Sorry, got some feedback there. Artificial intelligence, this is where with artificial intelligence, it's just not one thing, right? It's many different technologies working together to enable machines to, from a sense, comprehend, act, and learn like a human being. So this is, typically, like we talked about, machine learning, deep learning. Those are all subsets of artificial intelligence, and really makes computation of multi-layers in a more feasible manner. So with that, I'll hand it over to Janine.
Thank you, Keith. Thank you so much to all of you. I just want to quickly summarize. Keith talked a little bit about just the whole arena of healthcare, followed by a little giving you a snippet of Mayo Clinic and what we do in the organization, and a little bit of context in terms of some of the critical tools that we are using in the realm of intelligent automation. I just want to highlight, based on what Keith mentioned, artificial intelligence, AI is being used significantly at Mayo Clinic right now. That is a push of our CEO, and we're experimenting on multiple fronts with AI. As many of you might know, Mayo Clinic partnered with Google, and we can talk about that a little bit more, but Google is our partner in terms of really the whole data side, and we'll talk about that as we move forward. But AI is playing a very big role. I think just with that context, something that at Mayo Clinic we're very deliberate about is to, and all of you will, I think, will resonate with that, and that is we may have all these wonderful ideas and innovation and ideation, but at the end of the day, you have got to systematize it and design it very deliberately into the processes and the workflows and everything like that, so that it truly brings value to the patient, to the provider, and delivers the care that you're looking for. Just having these tucked away in little pockets is not going to deliver what we would like to deliver. For Mayo Clinic, our hallmark is integrated care and a really good patient experience and outcomes with the tightest cycle time. As much as I'd love to say people want to hang out in Rochester, Minnesota, not always. No, I'm just kidding. So Keith, if we could go to the next slide, please. So how are we thinking we want to do some of this? And as Keith moves, Keith, if you could just go to the next slide. Oh, there we go. So our initial, and I'm sure yours is as well, but our initial, excitement and everything and all that we read and everyone talked to us, we just felt like, success would really look like the one on the left. And honestly, you know this better than we do. What success really looks like, and we're still in the middle of the journey, is just being very prepared for all the twists and turns of what might seem very exciting. So with that, I'll share with you a little bit of what we've been experiencing. Thanks, Keith. If you can go to the next one. So first thing we did was to really say, yes, there's all this excitement going on. Mayo is partnered with Google. Mayo is now a platform organization, all of that. But how do you really bring this to fruition? And one of the key pieces that we worked on is having a process that would be able to consume ideas at various points in the maturity continuum. So it could just be a hypothesis to solve a problem. It could be something that is more of a proof of concept. We might have a prototype that we need to accommodate in this process. It could be an MVP. We know in many cases a physician or a scientist or someone else might bring us a minimum viable product. And what we wanted to be very humble about was to also allow our process our infrastructure and system to consume what might be available in the marketplace, because we recognize that our colleagues on the outside might bring wonderful inventions and we should be able to consume them quickly and bring it to the patient at the point of care. So one construct to really take this from ideation into more of translation and application was to be able to consume these ideas across the maturity continuum. Next thing that we built out was a capability model. We talked about products and processes because often people would get very confused with the two. What was some of the product pipelines that we were going to be looking at? They could come from our 3Shield mission, like Keith talked about, could be from our administrative side, our business side. It could be direct to consumer. Someone might just want to go straight to the patient or the referring physician. So we looked at all sorts of different kinds of products. And then we built out what we called a process capability, something that we would be able to take through the discovery, translation, and application continuum. As most of you know, anything you want to do in healthcare has to be tested, and rightfully so, to the extreme nth degree. It is so complicated. It takes between 3 to 5 years at the cost of $500,000 for a single algorithm, simple single algorithm, to work its way through the FDA process. So this is a tremendous amount of learning about how do you really take these wonderful algorithms, but make them sustainable and apply them. And that does not include all the changes that will take place because the algorithms are not static, they're very dynamic. So just something to think about, a capability model that builds both. Keith, if you can move to the next one, thank you. What we did then was we said, okay, let's look at what are these different pillars that we need to really work through. In order to make intelligent automation tools a reality. This is, I think, a variation, but more contextualized to IA that you might find in a management book, but it's easy to say that until you really are trying all of this. So we said to our leaders at Mayo, like everything else, you need a clear vision and a strategy for intelligent automation. It just doesn't happen like that. It's expensive, it's tricky, you have to manage it very carefully to what is the vision and what is the governance. What are the structures and roles that we need? And what is the talent that we need to hire? And how do we make this? It's a huge investment. And this talent is not easy to get either. A very critical aspect of the discovery is the data, and all of you are way more sort of, knowledgeable than I am, or maybe Keith is too. Keith, not speaking for you, on this whole aspect of data architecture, curation, segmentation. That's where we have partnered with Google to help us. And one very key aspect of all of this is de-identification of data. We have to be very thoughtful about the privacy and confidentiality and everything of the people that we care for. Translation, huge. How do you validate and test? What are the clinical simulations you're going to do? Moving then into the regulatory space, just experimenting with the quality management systems that are required to support FDA clearance, ownership of intellectual property, and every algorithm or intelligent automation instance and enablement has a risk in it. And we're working through how do you identify that risk, who is going to own it, track it, mitigate it as we move down the pipeline. Application, a lot of stuff with change management and education, etc. Sustainability has been a very tricky piece here for us. How do you update the models? How do you make sure that they are relevant based on changes in data, in patterns of care, changing research knowledge? It is really tricky. And what are the kinds of process and outcomes metrics you want to be looking at? I will not minimize the investment from a financial perspective. This is massive and requires very thoughtful orchestration. We have always been, as Keith mentioned, very patient-centered, and we're constantly looking at some of the experience and the other components besides technology of implementing intelligent automation tools. And finally, just for all of you, Mayo Clinic was the first healthcare organization in the world to leverage platform technology to deliver healthcare using that approach. And we'll talk about that a little bit more. Paul, I just want to be sensitive to time. So just let us know if we're crossing over or something, but Keith and I will plan. Okay, all right.
Will do.
Thank you. If you can go to the next slide, Keith. Keith and I did not want to leave out that through all of this work, we also wanted to pay a fair amount of attention to the analytics side of what was happening at Mayo Clinic and our work with these multidisciplinary teams. So we built out this analytics maturity piece because we were all over the map. And you can see we had to really be systematic about how do we take our EMR, for example, and we moved from what we had originally to Epic because we needed something that was much more integrated. So looking at that point of data collection and creation, really thinking about some of the business intelligence that would reside on the top. How do we ensure that clinical effectiveness is really being considered? And all of you know really well, then moving up the continuum of predictive and prescriptive. And no way we're all on this journey together like you are, but just orchestrating a more structured approach to maturing our analytics has helped tremendously. And we right now have a new department, which is the Center for Digital Health, which is playing a very significant role in establishing sustainable systems and an infrastructure to really mature analytics. So Keith and I did not want to leave that piece out. Keith, if you could just go to the next one. Thank you. So for us at Mayo Clinic, and I'm sure you are experiencing this as well, we really felt that we all had to raise our game. There was no way any of us could really understand this, and how do we manage it as a multidisciplinary team? So one of the things we looked at, is continuing to look at, is talent acquisition. Building out a more advanced curriculum and meeting people where they were so that they would be able to really understand this whole realm of what does a platform mean? What does analytics mean? What does ABCDE mean? Access to data, right from the data collection, garbage in, garbage out, as we've all always said, but that whole piece of the data trajectory and then access to data, keeping in mind safety and privacy and a whole bunch of other things. What are the tools and templates that we needed to develop and the capabilities? We've established very interesting communities of practice where like today, we can all sit down and chat and dialogue and share our learning. Plenty of experimentation. And I will just say, and Keith will agree with me, we are early in our learning, but we're trying to move it up really fast because if we want to meet our 2030 plan, we're going to have to really move fast. Keith, thank you. We thought it might be of interest to you to know that one of the things that we're looking at, Keith showed you this graph where you had control on one side and total freedom on the other side. And I wonder if you noticed that on the control side, we had generalists, and on the other side, we had specialists. We said we can't have one or the other. We're looking more to acquiring and nurturing talent that would be a blend of a generalist with a specialist, calling it the T-shaped professional. And here is a simple example of what are those competencies we need to have horizontally, and what are the competencies that may be domain specific that would be deep dives, and how do we blend teams so that we bring together the T-shaped model. And definitely learning, it's very it's something that's being pursued by major organizations in the world, and we're trying to see how that works. Thank you, Keith. If you can just go to the next one. So very quickly for all of you, I know we want to give you more time to discuss and ask questions, but two or three quick examples. One is for our in the space of artificial intelligence, a really well-known case study that we have, and it's being used, is the low ejection fraction algorithm. It was developed by our cardiology team. It's based on ECG signals. It is really important because it's an algorithm that does better than human beings to detect the low ejection fraction. That's the result that feeds in, and very quickly identifies any issues that the patient might have. And you'll see there is the treatment of asymptomatic left ventricular dysfunction, and how might we treat those patients. We put this algorithm in place, made it happen at pretty low cost, was tested, validated, etc. But all the while, the thinking was this would be used by cardiologists. And when we went ahead and implemented it, we realized actually it's going to be used a lot more by primary care physicians. And we didn't even, so that was clearly an indication in the early learning that you've got to have a multidisciplinary set of stakeholders, because you're not sure what you're going to get and how this will be used. We asked the question, how do we integrate it into the workflow? And Keith, if you go to the next slide, please. We worked through that with our primary care and cardiology team, and you'll see that we really worked through this by creating an awareness for early screening and prevention. We had the cardiologists work closely with the primary care physicians, and throughout the process, we gathered feedback. We integrated it right into Epic, so it would be available at the point of care, and then we scaled it again through our EHR. Some of the key takeaways for us, one, while the technical side was very, very exciting to everyone and the algorithm, it was the change management, getting in the key stakeholders, building that integrated workflow, and creating this as a reusable asset. You don't want to create application assets for every single algorithm. Look at how they could be reused. And that was a big learning for us in this whole process. Thanks, Keith. Another one where we have used analytics more specifically, not AI, this is for analytics, is in our patient experience and journey. Very quickly, the itinerary at Mayo Clinic is perhaps one of the most unique itineraries in the world. It's dynamic. It pulls together your entire journey while you're here as a patient. And as things change based on who you've seen, the itinerary dynamically changes. So it's one of those pieces, and it's highly optimized based on cycle time. So we are very proud of this. And we use analytics behind the scenes with a whole host of other efforts to manage the staffing, the capacity, the care that the patient is receiving, and dynamically building out and optimizing the itinerary. So that was another piece, and our patients really, really appreciate that. The last thing I'll just say is giving you another example. We partnered with IBM. Clinical trials is a bear. It's really hard. It's very critical for research and for FDA and other approvals. We partnered with IBM, Watson, and came up with, used their algorithm. Did not work at all the first time we implemented it. We put an engineering implementation construct around it and then integrated this algorithm into the entire workflow for our cancer patients. And Keith, if you go to the next slide, please. It was just really, really amazing to see that when we were integrated it right into the workflow, so the patients and their conditions would feed into Watson. Watson would identify based on criteria who were the patients who really could be potential for certain clinical trials to help with their cancer diagnosis. That would be presented at the point of care to the clinicians. They would then have not some, really good guidance available with all the clinical trials relevant to that patient, and they could work with the patient and say, Janine, would you be interested in this or that trial? It was just a complete sort of, change of what we could do for our patients, because it was too much for any clinician to know what are all the hundreds of clinical trials happening at the Mayo Clinic. So this was really a game changer for us in terms of clinical trials. Finally, I'll end by saying that another very big sort of effort for us at Mayo is the platform capability. That's a high priority for our CEO. His goal is to really transform healthcare and make healthcare accessible and scalable in the best form possible to the world. And so from the three first focus areas in the platform have been the advanced care at home. We've treated 800 patients with a partner where we've been able to discharge patients from the hospital and have them really get care and heal in the comfort of their home. It's been a phenomenal experience, close to 100% satisfaction from our patients with phenomenal outcomes. The second one is the clinical data analytics. That's the one we're working with a partner called Inference to basically gather, curate, de-identify, prepare data in a way that it's going to support the technologies that we want to enable. And finally, it's the remote diagnostics. And this is where we're working with Google to deal with how do you treat, really look at radiation oncology, breast cancer, a whole bunch of diseases that we could remotely diagnose and manage, which would be very supportive to the patient. Keith and I just wanted to highlight that one of the critical things with the platform is partnerships. Mayo's not going to do it on their own. Mayo's going to enable a suite of partnerships, bring in the best minds, and collaborate to develop this as quickly as we can across the world. With that, Keith, I know we're maybe running over time. If you could just take 2 or 3 minutes to close up on some of the things that we're thinking about into the future, but we just have to have you see this video. It just really gives you a glimpse into what is possible.
I muted you, Keith. Sorry, you might want to unmute, Keith.
There we go. Sorry, I'm back.
All right.
Hopefully, I'm hoping the audio goes through this. So let me, I'm gonna start it, and then just, Paul, if you want to give me a thumbs up that you can hear it, that'd be great.
I will let you know. No sound yet.
Okay.
You have the option when you are sharing your screen in Teams to enable sound that pops up when you screen share. You might need to stop sharing and share again to get that. If you hit the button in Teams in the upper right corner to where you share a screen, there is an include computer sound toggle, so that in addition to sharing your screen, you're sharing sound.
In the Teams window?
Yeah, the Teams share tray that opens when you hit the share options has an option for you to share sound as well as a screen.
Let me stop sharing and let me do it again. So hit this. Include computer sound. There it is.
There we go.
See it first. There we go. Thank you. We'll come back, and now I'll go back into screen. Full screen here. And switch again. Sorry. Love technology. There we go. We'll try it again.
All right.
According to AI
Great
experts,
sound.
brain implants could make learning obsolete in less than 20 years. Instead of reading textbooks or going to school to gather information, we'll have devices in our brains that download information on demand. That may sound like a lot to achieve by 2040, but based on where current technology is, AI expert Nicholas Karanos says the timeline isn't out of reach. A brain implant, also known as a neural implant, is a device often placed on the surface of the brain. It's capable of communicating with your neurons, recording their activity, and even telling them how to behave. One of the most common applications is deep brain stimulation, where electrodes are implanted into the brain to stimulate different areas and reduce the symptoms of brain-based disorders, such as Parkinson's disease or epilepsy. More than 150,000 people globally have received such an implant, but the implants can control neurons in other parts of the body as well. Doctors have used neural implants to stimulate the spinal cord, allowing individuals with paralysis to walk again. Amputees
I think the screen stopped.
were able to control robotic prostheses.
I think it stopped moving. Oh, caught up. It just caught up in a
About
bunch.
their thoughts. Then there's a host of examples that are straight out of sci-fi novels. For example, a team from the University of Pennsylvania's Computational Memory Lab successfully enhanced people's memory capabilities by stimulating brain regions using electrodes. Perhaps one of the most well-known brain implant companies is Elon Musk's Neuralink. The company's ultimate goal is to merge computers with the human brain so that human intelligence can keep pace with advancements in artificial intelligence. Neuralink uses threads in the brain connected to a 4mm chip called the N1. The company recently released a video that appeared to show a 9-year-old monkey equipped with the N1 chip operating a game of Pong using his mind. The N1 chip is just the first step for Neuralink. The team is also developing neural lace, a brain-computer interface technology. The ultra-thin mesh will be inserted via a tiny needle and encompass the brain. The goal of neural lace is to enable humans to upload and download information directly from a computer, much like Neo in the Matrix. Neuralink isn't the only company making headlines in the field. Led by CEO Ramses Al-Kaid, the Neurable team revealed the world's first brain-controlled VR game in 2017. Their device is a wearable that uses 7 scalp electrodes to record electrical signals in the brain. MindX is another brain implant company that aims to create a look and think interface for next-generation spatial computing applications. Users will be able to interact with computers using smart glasses that link with the human brain. The glasses will let wearers access information with a single thought. No more rummaging for your phone to Google a burning question. This is all just the beginning. There's a long way to go with this technology before we all have the option to get chipped, and many hurdles to overcome. After all, major elective brain or spinal surgery is incredibly risky. Still, engineers are working on tiny implants, such as the 0.25 square millimeter neurograins, as well as implants that can travel to the brain via the bloodstream, eliminating the need for open brain surgery. Considering all of this, AI expert Nicholas Karanos may be correct. In the next few decades, would you want to make your brain part machine?
Super fascinating, super fascinating. So, in honor of time here, I think, I think I'll just kind of mention these high level. I won't go through the slides much, but you talk about into the future. We're looking at edge computing. It's really how do we bring that computation closer to where it's being stored, and as we continue to use cloud and data centers out there, really keeping that information close to home. And so edge computing is another opportunity, especially with the Internet of Things and the mass data that those wearables. We talk about Internet of Things. There's also Internet of Medical Things. So again, you can just see the number of devices being manufactured in this realm, and you can see the Apple Watch there, or the the personal emergency response system. And when I see that picture, I always think of help me, I've fallen, I can't get up. You see, hit the button. But all that, again, this is just providing oodles and oodles of data. And I think the point here is they are related. As we look at edge computing and tie it into the Internet of Things, is really main benefits there is is speed. We don't want latency issues of an alarm going off and it takes a half a second to find it. We want that immediate. And at the same time, the edge computing also can favor in the bandwidth wise is having that more of a full flow of information and not be restricted. So with all that, I think we kind of touched on some of these already, but especially when if you want your brain to be part computer, there's ethics involved here, right? So we got to really take that in consideration, along with Janine mentioned it too, of data privacy. Mayo thrives on having secure data, keeping patients' information secure and private, and really want to maintain that trust. And so really, making sure that the information is de-identified, as well as, as we've seen, as we build these algorithms, want to make sure they're accurate and inclusive. So, is there biases around those? Especially, do we get a good population of ethnicity, of race, of culture, of location in the world? Those all play a big factor of, as the machine is learning and building those algorithms. And then, social determinants, we talked about that as well. This is where, it's not just a traditional scope but it's the person, where they live, how they learn, where they work, how they play. And that all is unique to that individual. And then finally, and we mentioned that before, is the financial piece of this, and really, what's the impact to the patient as well as an organization to bring those together. So, one might think, perception is this, beautiful car, go down this nice, perfectly smooth road in this beautiful sky blue. But in reality, it's pretty treacherous. It's pretty rocky, and you're going to have some bumps and bruises, but we're all up for the challenge. So with that, I'll stop sharing so we can get full screen here.
Nice. Excellent. Thank you so much. Now we'll have questions from the group. If you can give us another 15, 20 minutes of that, we'll probably have some great questions coming from people. If you want to type it into the chat, or if you want to use the raise hand feature to get called on to ask the question. I know there's been a couple put into the chat already. Nikhil, you were asking, how are the outcomes of IA measured? So, for example, in the ECG example and some others.
Thank you, Paul. Yes, that's it.
I can. Can you hear me, Paul?
Yes.
Yeah. Thank you. I can take that one, Nicole. I will just say that we are continuing to measure it. It's relatively new, but basically what Dr. Peter Noseworthy and his team are doing is they are monitoring how many times this algorithm is used, what was the outcome to the patient. They have very detailed research studies going on around it, because not only do they need to know as scientists and physicians, but you also have to present this data on a regular basis to the FDA, et cetera. So yes, they have a pretty elaborate way by which they are measuring it and constantly monitoring it. They're also using the EHR, the electronic health record, and the data involved in that to really try to measure and understand the process and the outcomes measures.
Nice. Rakesh had a question.
Yeah, first of all, I mean, this was an awesome presentation. So thank you, Keith and Janine. Appreciate it very much. I have a two-part question here. So one thing is, as I was sitting through and listening to you guys, I was wondering, how did you kind of influence or convince the doctors or the other users to kind of, use this decision-making using this data out there? Because, that's one of the challenges I do face here. Like, the users are not, it's you have to work through a lot to get them, because this is a change. This is a newer way of doing things, right? they're used to. So how did you do that? So that's one part I'm interested in. And the second thing which intrigued me is the FDA approval process. If you could explain a little bit more, like what kind of information you had to provide FDA to get that approval process, that'll be great.
Thank you so much. Keith, you want me to take it? You want to take it?
Yeah, I'll let you take the FDA question. I could take the first part. You have more experience in that realm. As you look at change management, right? It's huge, and how do you get the buy-in? And really, it's definitely not easy. And as we look at the three shields with Mayo, we got the education, research, and the clinical practice, and really, with the research arm, they got that innovation going on, and I think what they're trying to do is tie it back into the practice, and that's where you need to get those early adopters, especially as Mayo's being more forthright of being bold, saying we need to be in this area, we need to be in this game, we need to lead this charge, and so. It's one of those things where as we bring on, providers and scientists and stuff, they each have their own passion in these certain areas. And really with Mayo, with having, the multiple experts is really tapping into those and then expanding that to really grasp those concepts and then connecting them with, and I'm still part of this too, is with Mayo being 65,000 plus people, I still learn more about, I didn't know this group existed or this resource was available, and it just helps you, the whole networking within Mayo to truly champion that. And I'll let Janine add to that.
No, thank you, Keith. That's it. Rakesh, it was Rakesh, right? Yeah. Rakesh, the question that you asked, to us, I would just say to some extent we're blessed because the kind of people that we hire in an academic medical center, Mayo Clinic, they are just highly innovative. They are really wanting high initiative. They're wanting to do something different and new. And some of our residents and fellows and newer physicians are just all very, very tech savvy, and they want to blend science with technology. So it's kind of interesting. But having said that, I'm not minimizing in any way that you have to be very deliberate about getting them to recognize how is this going to make a difference to you and your patient. They really don't care about anything else. If you say, oh, this is going to make a bunch of money, they're like, too bad. That's not what I went to medical school for, at least at Mayo Clinic. They're like, tell me, how is this going to help me and my patient? So that's how we frame everything in terms of how is this going to help that whole care kind of story. So that's one. The other thing, Rakesh, that you asked for is very complicated, but what we're doing is we're understanding the different pathways that we need to go after for FDA clearance. So for example, if you want to commercialize something, you have no choice. Say you want to commercialize it with a partner, you have to go through FDA. But there are other options. You can do an algorithm implementation under an IRB study, right? So some of our physicians would want to go down that path. You could do it as enforcement discretion. So the FDA allows you that if you can prove that an algorithm is not as risky, you have years of experience in it, you're going to track it, you have a good QMS or a quality management system, they will give you approval under something that's called enforcement discretion to be used internally. As soon as you want to go externally or commercialize it, you have to go through the full FDA process. Now they are changing and optimizing, etc., but it is very, very involved. And in some cases, we have hired outside consultants to help us work through it because it just is too much. You need an internal infrastructure and outside consultants. But having said all of that, our hope is that the FDA will start to become much more optimized. So we are using IRB and enforcement discretion and a whole bunch of other options. Does that answer your question, Rakesh?
Yes, Janine. Yep. Thank you so much. That was great. So thank you, Keith and Janine, both. I appreciate it.
I had a question. There was a part in your slides where you were having on the curve of starting through business intelligence up through predictive to prescriptive, where there was an area under prescriptive that I would have loved to hear a little more about called
Okay.
social media analytics. And I'd like to understand what that is and how it is prescriptive.
So and it could be a spectrum. I agree with you there, Paul. But the prescriptive piece of that was really looking at trends in terms of how social media is being used, where because for Mayo Clinic, I mean, we're number one in sort of the US, but now number one in the world as per Newsweek as well. So it's really trying to understand what is our social media presence, what are the implications and impact of that social media presence, and how can we use analytics to basically predict what might be some of the implications of that social media presence. And as we go global, this has become increasingly important so that we understand in different markets what are the implications of playing in social media, branding, all of that. So we actually work with a few big firms to look at both the predictive and the prescriptive components of social media and the implications on Mayo's brand.
Nice, thank you. Any other questions? This is the time for questions. Raise your hand or feel free to unmute. We've never had a problem with too many people trying to unmute at once. I see someone's typing one up. Give them a second, but anyone else? All right, the scope of the overall platform seems so vast. How do you organize and direct it reliably toward valuable deliverables? By audience, journey, or some other method organizing concept?
At this point, we're going to do our best to kind of address that. But at this point, whoever asked the question, and Paul, to the whole team, I think the platform is also in a space of experimentation. There's no doubt about it. There is no major integrated healthcare platform, but we're learning from all other kinds of platforms that have been, very well established, be it Airbnb or Uber or anything else. Amazon has such amazing platforms. So we're learning from outside of healthcare. But our initial 3 to 4 priorities were around data, really data preparation and understanding the data, et cetera, and de-identifying it and what does that mean. The second was around dealing with a very real problem of people not wanting to be in hospitals and the cost of hospitalization, infections, et cetera, being huge. How could we deal with that, which was the advanced care at home? And the third one was truly using the platform to treat diseases in a remote way. And it's those complex and serious diseases, not primary care kind. So the cancer, kind. Think if anybody has had family members who have to undergo radiation. Think of the number of times you have to come in for the radiation treatment. And how invasive is that to the patient and their families, et cetera? If there's some way we can consider radiotherapy to be able to be delivered in other ways using the platform, and I don't know what that is, that would be really so I would say experimentation, we're trying different approaches, and then looking at where would we optimize the platform opportunity. We even have a couple of initiatives that we're doing in 2 other parts of the world to experiment globally.
Yes, nice, thank you. That question was from Jeff. He'll give a thumbs up because I think that answered it great. Thank you. The next question's from David. Where do you get the talent to develop the models and to explain them to others? I imagine those of us in this space are all thinking about that as we also look for that kind of talent. Any secret sauce you're willing to share?
Keith, I can take a shot, but you go first.
Sure. Yeah. And, that's always as we talked about raising the game, and I think that's something that Mayo's been fortunate is that, having that opportunity to bring on that additional talent, not only internally, but what we're also finding out is to partner and externally. So I think the point here is, Mayo has such a rich culture, and is to have kind of that blend is to have that internal support and expertise, and even in management, engineering, business consulting, we're doing the same here as we're bringing on new talent that has, a skill sets that I don't have today. But the whole point there is to raise, the sum of the parts is better than the equal of everything else. So the point there is, as we grow that talent internally, they understand the culture, they understand Mayo's needs of the patient, and then they can really help explain it. Not they're kind of that the connector between that expert as we look at the partner, to like the Googles and the inference, to bring that their technology and insights in, and then really bridge that with the provider and the care team, to make those models successful, and like Janine said, continue to experiment and learn.
Nice, thanks.
I just had a couple of quick things to that, Paul. I think clearly the partnerships, you can't go it alone. I think that's really important for us all to understand. I think leveraging connections as we're doing with schools is critical. I just think some of our younger colleagues are just able to assimilate and learn and move forward very fast on this. I think we have to keep an open mind on global talent. We have places where I come from, like India, there's in so much talent. And so how do we balance that out? The last thing I'll say, and this is, Keith knows this, it's one of my areas of sort of focus. How can we in all of our organizations take that extra step to work with our communities and schools and other places to build a diverse set of talent that includes, that's inclusive and is diverse? We're going to need it. One of the things that Mayo Clinic, being transparent, had a problem with is having a diverse set of participants in our clinical trials. If it was all going to be, people of one color, it did not represent the population and the treatment was not applicable. So I think as we move forward, I would challenge all of us, how can we work with our schools and communities to build out this talent? Because we're struggling. It's not easily available.
Well, I will say that the aspirational message and the Mayo's focus on the patient provides a great marketing tool to find that talent, I will say.
It does. Yeah, the higher purpose, there's no question.
Nice, yeah, thank you. Yeah. Any other questions? No one's typing, raising hands. Last call. All right. Keith, Janine, thank you so much for coming. We're going to fold into the part of our meetup where we encourage those to stick around and be more informal. If you'd like to stay so we can ping you with some more informal questions, it would be great. And we'll be trimming out this part of the recording and everything. But if you're sticking around, all my fellow meetup members, it's because you're going to turn your camera on, say hi, and reconnect with us on this area. That wraps up the official presentation. So some of you may be dropping off. See you later. I understand.
Thank you so much. I'm going to drop off, Paul. I have to start getting ready to leave. So take care. Thank you, Keith. Thank you.
Thank you,
Love
Janine.
doing this with you. And thank you so much to all of you. Very exciting, and let's keep in touch.
Thank you so much.
Have a safe trip.
Thank you. Thank you. Thank you.
We have a few sticking around. Keith, thank you so much. If you're going to stick around for a bit.
Stick around for a little bit. Yeah.
Thank you so much.